I'm out.
Dr. Eric Fete is the founder of Prime X, which is a preventive health and age management practice. He focuses on nutritional, hormonal balance, as well as muscle medicine for maximum health and vitality. Dr. Eric Fate was an ER physician, however, being disappointed with the way that medicine was being approached as a Band-Aid fix, he left traditional ER medicine and started this practice. So I'm really excited about speaking to him because we have a very similar background in that manner. And really focusing on muscle medicine is something that he does. So I'm really looking forward to speaking to you about that as well.
Hey, Christine, thanks for having me on. I appreciate it. Looking forward to it.
Yeah, absolutely. So yeah, actually, I wanted to talk to you about the term muscle medicine that you have in your bio, and I find it interesting, and I really wanted to get a little bit more information from you as to how you approach that and what you do with your patients.
Yeah, absolutely. I just kind of came up with that term, and I really focus on that because like a lot of people come to me for, of course, overall health and hormone optimization and body composition, weight loss type stuff. So for me, I try to really focus on instead of like that focus on I help people with the weight loss on the side, but my main focus is really building the body up. So my thing is like fitness and body composition, but it's not really about vanity. And the reason I say that is muscle medicine, because the muscle is so important. Most people think of it just as looking good in the mirror or, helping us just move and do stuff, right? But actually, muscle is one of the largest endocrine organs in the body, and it does so much for overall health above and beyond what people think of. So I really started kind of looking into that a little bit, and there's not a lot of people really focusing on that. I know a few of the docs, talk about muscle and protein and stuff like Gabrielle Lyon and a few other docs, but not a lot. So I thought that'd be a cool little niche, and I really need to probably push that exploit a little bit more. I just thought it was a fun term. I came up with muscle medicine. It just rings. But, like I said, for all my patients, I think as we get older, everybody's like, I want to live longer, I want to live healthier. And why are we getting tired? Why are we getting weak? And if you look at the pictures, we all get, thin and old and stooped and frail. I'm like, do we have to be that way? I'm like, I don't think so. I think if we focus on keeping our bodies strong and adding as much muscle as we can while we're younger and preventing that, that will stave off a lot of the disease processes. And I think sarcopenia is such a big deal in sarcopenic obesity, where we're basically losing muscle and gaining fat. It's a vicious cycle. We start to gain a little bit of weight as we get older because of all the different things we're going to talk about, but then we lose muscle too. And then that loss of muscle makes us gain more fat, and that extra fat makes us lose more muscle. And it's just a vicious cycle. So I want to kind of dial that back a little bit.
Yeah, no, and you bring up a really good point, because a lot of my patients are postmenopausal women, and they're like, oh, I'm struggling losing weight, and a big portion of it is, yes, your metabolism does drop, but a lot of it is because of the fact that you're losing muscle and you're not really adding more muscle. So do you see a lot of postmenopausal women, or is it mostly men that you see? Because I feel like muscle medicine is like very intriguing to men, right?
Yeah. And that's the thing, is I'm trying to really focus more on, that's kind of why I create a whole separate website just for weight loss, more for women, because I don't want them to, my main site is a little more guy feeling. I need to shift that a little bit, because I do have a lot of women actually. It's probably, I don't know, almost 50-50, maybe 60-40, but I have a lot of women, and mostly perimenopausal, postmenopausal. And that's kind of the shift I kind of try to approach them. And you probably know this too, is like so many women are so still scared to eat a lot of protein and lift weights. And they're like that all those old stereotypes out there, right? Like, I'm going to get big and bulky, or I'm going to, do that. And they just don't, so my big thing is lift the weights, more protein, more protein, more protein. And it's just, and it does. And I try to shift that focus. You're not going to get huge muscles, but if you want to lose weight and get, better skin and look better in the mirror, this is what's going to help you. And sometimes, they're so hesitant, but when they do it, they do it, and they see it and they feel it, and they like, oh, I get it now, so it's a hard sell.
Right. No, it's true. I'm curious what you think about, because it kind of relates to losing muscle. So I know a lot of people like to do like long-term fasts, like, like these 3 or 4 day water fasts. And I'm not really a big proponent of the longer fasts. I mean, I love intermittent fasting, and I love anything that's kind of 36 hours or less.
Right.
Mainly because, once you start fasting a little bit longer, I feel like you are going to lose muscle unless you're actively not, and doing things like that. But what kind of suggestions, or are you a fan of longer term fasts, or what kind of suggestions do you make for your patients?
Yeah, I think that's a great point, Christine. I think fasting, of course, as you know, has been such a rage in the last number of years. And I feel like everything kind of comes in phases, right? Things are in, then they're out. That, you know, kind of like keto
Yeah.
is such a big deal. Now it's kind of like, eh.
Yeah.
And I was never really big on keto. You know, I mean, I think it
Neither
has
am
its
I.
use, but with fasting, same thing. I agree. When I first started digging into it, I'm like, yeah, that can be useful, but I agree. I think that it's pretty clear that anything beyond 3 days is you're definitely going to start burning through muscle. And a
Yeah.
lot of people say, well, I'll just do it once and then I'll start eating again, put muscle back on. So it's you're kind of getting into that bodybuilder routine of like they cut, they build, they cut, they build, they cut, they bulk. You know, I'm
Mhm.
like, why, you know, every little, why go in a deficit and then have to come at it, you know, come from behind to catch up again, just
Yeah.
maintain it, you know. So why, I don't want to lose any muscle. Again, muscle medicine, right? So let's keep that muscle and build it, if anything. So I agree with you. I don't think anything, you know, longer than that is really necessary. I think you can get tremendous weight loss just doing, you know, one 24-hour fast at, you know, once a week or
Yeah.
maybe twice a week or once a month or whatever your goals are, or
Yeah.
just doing, like you said, maybe some intermittent fasting or some occasional longer fasting, like 18 to 20 hours a couple times a week. I think you'll still get the benefits. I mean, you know, a lot of people say, well, you really get all the autophagy and all of that cellular turnover if you really go 3, 4, 5 days. And yet that's true. But then you have to look at the big picture. You know,
Mhm.
there's so many other things that are happening. If you're losing muscle and all these other negative things are happening, that's not good. And there's other ways to turn on
Yeah.
autophagy,
Yeah.
right? You know,
Yeah.
exercise is probably one of the best ways. So,
Yeah.
and you know, nutraceuticals, hormones, peptide, you know, so many other things that turn on autophagy that you can do that kind of, I'd rather do a bunch of little things that get the same result without the downside. So that's my
Yeah.
take.
No, I think that's a really good point. And, you know, I think you can kick into autophagy. Most people do it 20, 24 hours anyway.
Right.
So you brought up a really good point. Maximizing that with exercise really makes a difference, I think. So,
Yeah. So, and then the other thing, which I'd love to hear your perspective on this too, because I know you have a lot of information and knowledge on the gut and the microbiome. And I've been delving into that a lot in that last number of years. And I know I have a friend of mine, a colleague who talks a lot about this with his protocols, but, you know, he calls it an amplified fast, you know, like using
yeah.
your gut to kind of hack it, so to speak. So even if you're only fasting 12 to 16 hours, you can get all the benefits of like a longer fast, or maybe. So like, you know, the night before, you know, you're going to be eating more like resistant starches, take some berberine, some other things to kind of get your mitochondria sped up, get the AMPK ramped up, get
Yeah.
that gut microbiome, making that bifidobacteria to kind of help
Yep.
augment. So when you go in the next day, you know, you're ready, the fasting's already sped up a little bit. So those are some protocols I'm kind of playing around with too.
Yeah, no, definitely. I mean, I always call it the survival of the fittest phenomenon, right? When you fast, right, and then everything in your body is almost like in low battery mode, but in your gut as well, right? Your gut bacteria, the strong, really good ones, are like, okay, we can survive this, and actually they flourish.
Right.
Whereas, you know, you're killing off some bad bacteria. But yeah, no, I agree with you. I wanted to ask you another question about testosterone levels, because I know that you work with hormonal health a lot.
Yes.
And, you know, there's been kind of a steady decline of testosterone levels in males, even just
Yeah.
over the past, you know, 40 to 50 years.
Yeah.
And it's hard to pinpoint where it's coming from. Personally, I feel like, you know, our diets are very different. I think we have all these
Mhm.
xenoestrogens in the environment and all these other environmental influences. But what are you seeing that might be, you know, like main attributing factors to the lower testosterone levels that are, you know, we're seeing in males?
Yeah, I agree. That's an astute observation. I agree 100%. I'm seeing that more and more, and younger guys and women
Yeah.
have
Yeah.
earlier drops in their hormone levels, which is kind of frightening.
Yeah.
And I'm starting, now that I've been doing this for a number of years now, I'm starting to see the contrast. So, for example, I'll get in some men and women that are, say, in their 60s and 70s. They've got hormone levels that are better than most of my guys in their 30s because they
Mm.
were living in a different time period. They've had
Yeah.
all that time to live at X environment, and now they're older. But now the younger generation has grown up in a completely different environment, and
Yeah.
with lower levels. I'm seeing it all the time. I'm seeing younger and younger men and women with their hormone levels are horrible. And yeah, I agree. I think it's all environmental. I really do. I think unfortunately we live in a very toxic world. I mean, we're surrounded by EMF and plastics and xenoestrogen and glyphosates everywhere, toxins everywhere. You know, chemtrails. I mean, you can go down all kinds of rabbit holes, right? There's all these nasty things in their food, or nutrients are getting depleted out of the soil, and you know, fertilizers, pesticides, plastics, heavy metals are everywhere. So we just live in a very toxic world, I think. Not, and then you throw in all the stress that we're in
Yeah.
modern lifestyle, work, and 24 hours of light and blue light, and work harder, sleep less, everything else. So it's just I think it's a vicious cycle. And I think it's a combination of all those things. And our bodies just weren't meant to handle that. Our ancestors didn't live in this kind of world. They, sun up, sun down, they go to bed when it got dark, and they didn't have they had pure air and better food and better soil. And we've been around for how many millions of years, but we've only had a few thousand years. I don't know the numbers, how many thousands of years to adapt this new lifestyle. We just haven't had time to adapt, and it's just taking a toll.
That's a really good point. It's like, I feel like so much has changed in the past 50 years, like more so than in the past several hundred years. And you brought up a really good point about stress, because, cortisol is being released all the time, and that's going to bypass the hormone production for testosterone, but all the others. But, another thing is we're seeing more and more people who are obese, which I think is also contributing.
Yep.
Any thoughts on obesity? And again, a lot of people don't even realize, like, your fat's turning into estrogen if there's a lot of it. And that's probably, going to not really help you with elevated testosterone levels. So I'm curious what your thoughts are on that.
Yeah, I could probably talk for about an hour about that, but yes, obesity is a big problem. And I think, as we mentioned, it's definitely lifestyle and environment for sure.
Yeah.
Tremendously. And I think we're just, again, not only just the toxic world that we live in, but it's our lifestyle. Like you said, stress is a huge thing, and cortisol, not just cortisol is very important if you use it right. But
yeah,
when we're stressed out financially, emotionally, everybody's just, working hard and getting creamed by taxes and life and stress. And it takes its toll. That chronic stressor, that's a whole topic in and of itself.
Yeah.
But I think the whole lifestyle aspect is that, our modern society is geared to quick fix, easy. Right now, it's like you don't have to leave your house. You can get Amazon, click a button, get stuff delivered to your door. You can DoorDash. So many people are so much more sedentary nowadays, way more than our ancestors were. And so I think it's a two-pronged thing. We're having more stressors and environmental changes. Our intake of our food is not as good because we're eating so much junk and processed foods and all these bad foods, and then we're not moving as much.
Yeah.
I just read an article I'm going to probably do a video on for about like the whole thing of sarcopenic obesity, and it's just, yes, as we get older, there's all these things that happen that can slow things down, but we're also becoming less active and more sedentary and more stressed, and then you throw in all the lifestyle factors, and then kind of goes back to what I said. Now we're gaining some weight, we're a little bit less active, so we're losing some muscle. Now it's just a vicious cycle, and and it builds on itself. So we need to flip that. If you look at, I forget the name of the book, I read a really good book on this, going back through history and anthropology. It just talks about, if you go back to like some of the hunter-gatherer tribes, like the Hadza and some of these other people, they were very healthy or very leaner because they're always active. So a lot of, and you can only do so much. I think the premise of the book was you can't out exercise it, right? You can only do so much. Our bodies are going to stop. But when you combine that with all the other factors, it makes a big difference. So when it comes to obesity, I think that lifestyle factor is a huge thing. A lot of people are like, oh, why? I go to CrossFit and Orange Theory 5 days a week. Okay, that's an hour a day, but what are you doing the rest of the day? Well, I'm sitting.
Right.
I'm not doing anything, and I'm eating my snacks, and well, there you go. And so I think it's a combination of things. And going back to your point about the estrogen, this is a whole nother topic too, and this is very much misconfused, is that estrogen is very good. The estradiol, I should say, is good for our bodies.
Right.
And a lot of people are still scared of it. But it's the type of estrogen the kind that our body makes is what we want, right? But what happens is, as you mentioned, if you get too much fat, it can make estrone and some of these other estrogen that can cause some feedback inhibition of your testosterone. So a lot of people think estrogen is bad. Well, it's really not. It's where it's coming from. Because a lot of times with my women, especially my women and my men, as they get older and I have to put them on hormone therapy, I give them estradiol, and it actually burns the fat and helps their metabolism and makes them feel better. So a lot of times my fix is to give them estrogen. Even they're like, well, isn't it bad? Like, no, it's actually therapeutically, it's very good.
Right.
But
it's the pathway, right? It's the pathway of where estrogen's being made. There's good pathways and bad pathways. So you want estrogen that you're making down the good pathway, estradiol.
Exactly. Yep. Yeah.
Yeah. Okay. What do you think about, this is probably going to be like a little bit of a controversial topic, but what do you think about marijuana use and lower testosterone levels? Because they're kind of conflicting studies. Like some studies say, oh, marijuana actually increases testosterone. But when you look at the studies over long-term periods of chronic marijuana use, it's actually doing the opposite. So, but a
Correct.
lot of things are like that, right? Good and small, doses. I'm not
Right.
recommending for everybody to go out and smoke marijuana, but
Right.
chronic marijuana use is really not good. I mean, and it causes testicular shrinking too. So would love your thought on that as well.
Yeah, I agree. I think, for me, I try to be and have my clients be as natural and clean as possible. Let's try
Yeah.
to get everything synthetic as much as possible. Yes, we're going to recommend nutraceuticals or hormone therapy, but they're bioidentical, meaning they're more natural form.
Yeah.
And let's try to get off as much synthetic stuff as we can. So cannabis, right? And everybody say, well, it's natural, right? It comes out, it's an herb, it's kind of like tobacco. Yes, it is natural, but the dose determines the danger, right? It's either therapeutic or it's toxic, as with every medicine or every herb, right? You can have too much of anything. So I agree. I've looked at it too, and I think if someone was like, okay, I'm going to do some gummies, or I'm going to take a toke once a month or something, or every now and then, yeah, I don't think that's an issue. Kind of like drinking, right? I mean,
Yeah.
I always tell everybody not to drink, and alcohol is a toxin, right? It's really not healthy for you in any amount, but
Yeah.
I still like my bourbon, and I still have a glass, once a week or whatever.
Yeah.
You got to live, right?
And
But
sugar. Yeah.
should I drink it at all? No, of course not.
Yeah.
But
Yeah.
so same thing with marijuana. But I think
Yeah.
the studies are pretty clear. I think chronic use, regular use on a regular basis, even if it's just a couple times a couple times a week, every single week over time, I think the cumulative effects have very negative consequences for just health and hormonal health. And they've done the studies with the MRIs, CAT scans, and showing the atrophy of the
Yeah.
brain, these changes on these real advanced images showing decrease of neurotransmitters and decrease of hormonal function and adaptations with chronic usage. So I think if you're doing a lot of it and doing it pretty regularly, I think it's pretty clear it's definitely going to damage your hormonal pathways long
Yeah.
term. And it could be in a few months, it could be a few, you may be able to do it for 10, 20 years. Who knows? Everybody's different, but
Yeah.
I don't think it's a good idea to do it on a regular basis chronically, and certainly in high doses.
Yeah, no, I agree with you. And I'm curious, like, what your approach is to, like, say you get a male that comes in that has low testosterone levels. How do you approach that kind of patient? What do you do?
Yeah, so I like to just, sit down with them and spend a little time with them, kind of going through everything we talked about in terms of their lifestyle. I like to really peel the layers back.
Yeah.
So many people are so focused again when you're on that quick fix mentality, like,
Right.
hey, doc, I'm tired, I don't have sex drive, I need testosterone. Well, hold on, let's back up.
Yeah.
Maybe you don't, because a lot of guys or women don't. They have other things that. So I like to look at a top-down approach and really hit it from the core. Let's figure out why. And I go through everything, right? And my top two are sleep and stress. Those are foundational. If you're not sleeping, I don't care what you're doing. If I had the magic pill to make you Superman, it's not going to work if you're not sleeping, right? So
Right.
sleep and stress is huge. And then we look at diet, and what you're eating. And then we look at movement. And then we look at everything you're putting in your body. And then everything else, like emotional relationships. If you're in an abusive relationship, or if you're working 14 hours a day or whatever that may be. So I try to figure out
Yeah.
why their testosterone is low and see if there's a correctable cause. And sometimes there is. And
Yeah.
if there is, we can fix it, and then you're done. You don't need anything.
Yeah.
Um,
I know.
but if not, and if we go down that road and we fix all those things and it's still bad because of whatever they had, they're just they've been exposed for too long, they've been living in a poor lifestyle, and then their pathways are just shut down. Well, maybe they need bioidentical hormone therapy, and I will do that. But again, I always like to look at the underlying causes first and fix it. So I
Yeah.
try to do everything. Let's do the free, easy stuff first, and
Right.
then we'll build on
Right.
that.
Yeah, and this is what I really love about your approach too. Having been someone who was in traditional medicine, working in ER medicine, and myself working in internal medicine, there's nothing wrong with that. But I think we've just become a society of, what's the fix, what's the quick fix, right?
Right.
And there's a place for medications. I don't argue that, but a lot of times your body's pretty smart, and then it gives you symptoms, and you can figure it out and try to address the root cause before you kind of jump to that quick fix.
Right. I
Yeah.
think I try to do that first with everybody. Now that being said, there are cases of people where I will treat them pretty aggressively right out of the gate because I'm concerned about them from a health
Yeah.
perspective. Like, so if I get a, 55-year-old guy and he's overweight, he's got metabolic syndrome, his lipids are out of control, his inflammatory markers are off, he's just tired and motivated. He knows he needs to
Yeah.
exercise, eat right, and he just can't. Well,
Right.
that might be a guy I'm going to put him on a regimen and optimize his testosterone with therapeutically, and may put him on some nutraceuticals just to get him going and use everything
Yeah.
just to put that fire out. Because otherwise,
Right.
yeah, he's not eating, he's not sleeping, we need to fix that. But we could do that, but it's going to take time.
Yeah.
And it's kind of a ticking time bomb, right? I mean, it's going to take time and it could work, but he may not have that drive to do it. He won't have the motivation to do it. And meanwhile,
Yeah.
his markers are out of control, and he's getting fatter and more inflamed, and he could have an event. And I don't want that. So I'm going to hit him with everything I got right out of the gate to prevent him from dying. And
Yeah.
then we may be able to peel it
And
back a
take
little bit,
steps
just do
back.
lifestyle.
Yeah, no, I agree with you. I'm not a fan of like the semaglutide type medications. However, I think we're probably going to agree on this too. Is if you have someone who's really at higher risk of having a complication, a heart problem or anything like that, and they're morbidly obese, you know what? There is a place for these medications, but I think it has to be coupled with a diet and lifestyle modification. And these are really the only kind of instances where I say, okay, you know what, maybe you are a candidate. But I think for the most part, we're such a society of just, oh, let's just quickly fix this. And that's not necessarily the best option. So
Yeah, and that's a good point. And I talk about that. Sometimes I go on my soapbox on my videos because like I do use the semaglutides a lot.
yeah.
But what I'm seeing is same with testosterone. It's like I'm seeing it. I use it, I use it a very particular way, and I rotate my therapies, and I use other therapies in addition to that and try to get them off it.
Yeah.
What I'm seeing the trend is, of course, now everybody's doing it. Now we've got like coaches and internet gurus and salons and people who have no medical training, whatever, somehow hooking up with someone to prescribe it for them and giving it to everybody, and
Yeah.
they don't know what they're doing. Same with
No.
testosterone. You
No.
look at all these fitness gurus on Instagram telling people how to basically practice medicine without a license. They're telling
Yeah.
people, "Oh, come to me. I'll look at your level, your hormones, and I'll help you get this and help you get that." And like, you don't know what you're doing. Everybody thinks it's a cookbook and it's super easy,
Yeah.
but it's not. There's so much more to it. It's very
No.
complex.
No,
And
I agree. I
and I
agree.
see these people because they come to me after they've been to these people and they get messed up, and I have to fix it.
Yeah.
So
Yeah, no, I agree. I mean, social media is great for a lot of things, but there's so many people on there that are just kind of portraying themselves as experts and doctors, and they're really not physicians.
right, right.
And I think it's unfortunate that the general population doesn't realize like you really need to look for somebody who has had that training. Like us. I mean, yes, we're not practicing traditional medicine, but we've learned the human body in such a intense way that there are so many intricacies. So people have to be really careful who they go to for
For
that.
sure. Absolutely.
Yeah. Okay. So I have another question because a lot of people kind of watch this and they think, oh, well, they're both fit and whatever, and I don't know how to start. But there's always a way to start and kind of just start easy and then work your way up. And so I kind of wanted to ask, what's your best advice for somebody who really hasn't done anything at all in terms of exercise or diet? How do you approach them and how do you start with them where they're not overwhelmed? But also, like, what's your favorite type of exercise advice? Like, do you like high intensity long, or do you like more long but lower intensity, or do you like the quick bursts of the high intensity, the short bursts like Tabata, for example? Like, what are your favorite types of exercise recommendations?
Yeah, those are great questions. Yeah, thanks. And that comes up a lot. So I think, everybody's different, right? That's, there's no
Yeah.
one answer, but I think if somebody's has no idea, they're fresh out of the gate, I always just try to start with simple changes. I don't want to overwhelm someone with these really intense regimens and radically undoing their diet, because they're not going to do it.
Yeah.
If they're drinking 5 cups of coffee a day and 5 Mountain Dews, I say, okay, cut it down to 1 or 2,
Yeah.
if
Yeah.
they're not doing anything, okay, go walk. Just
Yeah.
walk. Can you walk
Yeah.
for 30? Can you walk for 30 minutes a day? Well, yeah, I can do
Walking
that.
is so underrated, in my
It's
opinion.
so underrated. It's one of my
Yeah.
favorite tools because it's such a great, anybody can walk, and
Yeah.
it is great for fat burning and just for overall metabolic health and clearing your mind, lowering stress. It kills multiple birds at one stone. So everybody can walk, and everybody has time. I hear that all the time. Well, I don't have time. Like, everyone has enough time. We all have
Yeah.
24.
Yeah.
Let's go through your schedule and see what we can cut out. So just walk, and then maybe just simplify one thing. I'll say, okay, start your day. I ask them, what do you eat in the morning? What do you eat at night? And again, muscle medicine, I try to focus on protein. Just do
Yeah.
1 protein shake a day, or instead of, your muffin, do 3 eggs and a piece of, piece of meat or something like that.
Yeah. Yeah.
Try to shoot for like, 30, 40 grams of protein.
Yeah.
That's it. And then we'll add another round, in the evening, try to kind of bookmark your day, and make sure you bump up the protein. Let's walk every day. Okay. Strength training, again, muscle medicine. I want everybody to lift weights or do some kind of resistance training. Everybody should be doing that. Now, I know there are some people who just absolutely hate it. And I get it. And if that's you, then fine. Maybe they can do something like power yoga or
Yeah.
body weight exercise or bands or something, some kind of
Right.
resistance. They need that to build the muscles up. So that really should be the foundation, is the strength training. Because again, I try to explain to them how important muscle is and how that's going to help them shed fat and feel better. They're not going to get big and bulky, right? So my basic thing is like, look, starting out, just can you do some type of resistance training just twice a week to start, and walk every day for 30 minutes to an hour. 20 minutes here, 20 minutes here, 20 minutes here. Can you do that? Oh yeah, I can do that. That's easy. And then we'll build on that from there. So I think just out of the gate, and then later on, then we can layer on, if especially if fat loss is our goal, to start layering their cardio, it's like you were talking about. I think the low intensity is great. Walking is fantastic. And if that's all they do, I think they can make great improvements just doing resistance training and walking. But they really want to accelerate, they will probably need some additional cardio. And again, it comes down to their preference. I think the zone 2 is great for a lot of people, but I think a lot of the studies have shown that more higher intensity, shorter bursts are more effective for long-term fat burning and quicker results. But not everybody can do it. I don't think
start slow. Yeah.
Yeah, and they don't even have to do anything like a Tabata, because some people don't like it. Some, if your form's off or whatever, so you could do some modified, interval training is very simple to do. And another thing I'm a big fan of is something what's called alactate training. So you're kind of like, you're not quite to the point of getting into lactic, you're building lactic acid like the Tabatas, but you're doing enough that you're going to stimulate that fat burning machinery. So say you'll do like all out for 10 seconds, like 10 kettlebell swings, or something to that effect, and then you rest until the next minute, and then every minute on the minute you're doing 10 or 5 reps of something, and then you repeat that for like 10 it feels kind of easy, but you're still working the cardio, and it's a good way to do it. So I like to rotate in those cycles of maybe some alactate versus some higher intensity, maybe a couple times a week. And then just kind of build on that from there.
Yeah, I mean, you're right. Like, so many people are like, oh, I don't have time, but you do have time. Take the stairs instead of taking the elevator, right? Like, I now never, I mean, I started taking the stairs like 3-4 years ago, and like you do like 2 flights and you're like, oh, that was tough. And now it's kind of built up to 7 or 8 a day, which is so easy now, but it's all a build up. And I think, just start wherever you are and kind of build slowly.
Yeah, I think if you look at our body's ability, like what they call the total daily expenditure, right? The biggest contributor to your metabolism is NEAT, that non-exercise activity thermogenesis. It's what you do throughout the day, not hitting the gym. Like, remember at the beginning of our conversation, we're saying, well, I work out great an hour a day. Okay, what about the rest of the day where you're sitting, moving? Well, try to build in. The other thing I tell people, especially if they're really busy, I say just build in some movement throughout the day. So if you're sitting at your desk, I say put a timer on your phone. Everybody's got their phone, right? Every half hour, get up,
do
either
jumping jacks, right?
Either squat up and down, move around, jog in place for, even if it's just for 30 seconds to a minute, every 30 minutes, right? Everybody can do that. As you said, take the stairs, park further away, just move throughout the day. Like, I'm constantly like standing, sitting. I'm always moving, because number one, I don't like to sit. But number two, I just like to get in that movement. So everybody can do that, right? If you're watching a video, just pace around while you listen. If you're doing a podcast, go take a walk while you listen. But no matter how busy you are, everybody can take a break, even if it's just once an hour, to move. I think that NEAT, focusing on that, you're going to get amazing results with fat loss and body comp and just overall metabolism just by doing that without even going to the gym.
No, you're right. And we saw the opposite effect during the pandemic, when everyone was home, not moving around, and how many people gained so much weight and now they're struggling to lose it.
Absolutely.
Just,
Absolutely.
just from, just like minor things. So yeah. Is there anything you wanted to add? I know you see patients virtually. So what do you do, for example, when you have a patient virtually that you want to start on a semaglutide? Do you mail it to them, or how do you do that?
Yeah, so I'm able to prescribe. I can order any of my lab tests or my advanced tests from afar, and my protocols, whether it's hormone therapy, thyroid, testosterone, estradiol, progesterone, or peptides like semaglutide or any of the other peptides. I can get them through my pharmacies and have them delivered to the patient so they can self-administer. So it's super easy. I have my license in multiple states, so I see patients all across the country via telemedicine, just like we're doing now. And I try to structure it as a program. So I like to have regular follow-ups with them. I'll send them some guides and some tips on ways to do different things, whether it's diet or exercise. and just
Yeah.
kind of follow them along. I don't want to just write a script and send them on their way. I want to follow up with them,
Yeah.
be involved, and have it. I treat mine are more like coaching programs more than anything. So
Perfect. All right. Well, thank you so much for doing this with me.
yeah, absolutely. If happy to help and happy to jump on anytime if people were interested. I mean, I have two websites, drericprimex.com and then primexweightloss.com. And then I've got a ton of stuff on social media. It's free. And I got on my main website, the Primex, there's a bunch of free downloads if they're interested in like some hit intervals or some diet guides and things like that. So, but anything I can do to help with you and your followers, I'm happy to do so.
Thank you. Absolutely. And I'll post your link on YouTube when I post this. So,
Awesome. Thank you
all
so much
right.
for having
Thank
me
you very
on. That
much,
was
Eric.
fantastic.
All right.